Good morning everyone, this is Dr. Anwar from Badr Al Samaa Falaj. Today I am going to give you a brief insight into about most common ENT disorders in children, because as we see ENT disorders in children are very common. So we have got many disorders which we have to identify at the earliest. Like for example, hearing loss in children is a very common disorder which is usually misdiagnosed or which is not seen usually by general practitioners. So because it is so important, because unless you diagnose the hearing loss in children at the earliest, there will be many speech delays will be there, or lot of developmental delays will be there in children if you do not diagnose it. So we have got a variety of equipments in our ENT practice. Like we go for a brainstem evoked response audiometry. That is, as the child is born, we advise all the neonates in the OT itself. They are advised that they have to go for a brainstem evoked response audiometry to check whether there is a normal cochlear function or no. So basically, to speak in layman terms, we have to see whether there is a normal functioning nerve for the child or no. This is very important because there is something called neural plasticity which is present till 5 years of age in all children. That is, if the children, if they have any issue in hearing, there will be a lot of speech delay and developmental delays. So if you diagnose what is the exact cause of hearing loss, it is easy to treat them. For example, it is very difficult for the child to tell whether he is having any hearing issues or no. So usually it is the parents who tell us that the child is having hearing problems. So the basic problems which we have to evaluate is, maybe there can be a wax in the ear, which is a very common thing which is seen in most of the children. So it just needs, we have to do the wax impaction, whatever is there, we have to just clean it. And there is something else which we call it as a glue ear. It is a very common condition. We call it as a non-suppurative otitis media. It is one of the most common cause which leads to hearing loss in children. So we have to evaluate why exactly he is having this glue ear. So there are many reasons for children to have glue ear. So we have to evaluate other causes like allergy in children. And there is something called adenoid tissue. This adenoid tissue is nothing but a mass which is present behind the nose in most of the children, which is a physiological. But in few children, as the child grows, it causes obstruction. It causes nasal obstruction, and it also causes fluid collection inside the middle ear. So this fluid collection in the middle ear causes hearing loss in children. So identification of this is very important. So it is done by doing a very small test. This is called a tympanometry scan. By this we diagnose the glue ear. So once we diagnose the glue ear, we treat it. So once the glue ear is treated, the child has a normal hearing. So and many other things are there in children, like children present with persistent nasal obstruction. This is one of the most common cause because of adenoid enlargement. So systemic evaluation in children, like multiple aspects in ear, nose, throat, is very important. So a pediatric and ENT multidisciplinary approach is very essential. And in speech, if you see regarding the speech, many children have tongue tie. So this is because unless if there is no proper movement of the tongue, there is a slurred speech in most of the children. So it's a very common disorder. So we just cauterize the base of the tie in the tongue, so that it becomes normal, they speak normal. So and other conditions like in the neck we can see thyroglossal cysts are there. So they should be diagnosed. That is a very important thing. And in the infants and children, sometimes there is a lot of stridor is there. So parents are very much worried about it. So we have to, the most common cause of stridor in infants and children is a laryngomalacia. So that is a very common congenital condition in children. So it should be, there is no treatment for that. It needs a lot of reassurance. And other things like in the ear, if you see, there are many other things like ear discharge. So we have to address all these issues. So it may cause many other problems, many complications can be there. This condition we call it as a chronic suppurative otitis media. So these all things should be dealt. So it's very important that a multidisciplinary approach between a pediatrician, general practitioners and ENT doctors is very essential. Thank you.